everyone, so let's move towards our today's topic, which is
large intestine. Okay, now we have already discussed about the small intestine, okay, in a separate lecture, but in this lecture we will gonna talk about the large intestine. Okay, now as you know that the food enters through the mouth and then it enters into the esophagus, then stomach, then small intestine. The parts of small intestine are duodenum, jejunum and ileum, and then afterwards large intestine starts, and from large intestine it enters into the rectum, and then anal canal, and then through anal canal it excrete out of the body. So what happens, like I said, large intestine. In this lecture we will gonna talk about large intestine. So large intestine is a part of digestive system. Okay, it is a part of digestive system which is from ileocecal junction to the anus, and that consists of following parts. Okay, obviously the large intestine, the diameter of the large intestine is greater than the small intestine, and it do not consist of villi. Okay, it helps in absorption of water and some other materials as well. We will discuss in the physiology part, but in this lecture we will gonna talk about the anatomy of the large intestine. Large intestine consists of following parts. Number one is cecum, which is directly attached with the ileum. The part of digestive system just after the ileum is called as cecum, which is a part of large intestine. Then after ileum, colon part will start, and now colon is divided into 4 further parts. Okay, so ascending colon, transverse colon, descending colon and sigmoid colon. What happened, the ileum is present in the lower region of the abdomen, and then it is connected with the cecum. Then after cecum it is connected with the ascending colon, which brings the which is the pathway for the food to bring it upward, in upward direction. Then transverse colon, which is like a horizontal part, and then again the colon will move downward, and that is called a descending colon. And then descending colon is connected with the rectum through sigmoid colon, which is a tube-like structure, which is a small straight-like colon, straight-like structure, that is sigmoid colon, and then from rectum and then after anal canal. Okay, now what happened, first we will gonna talk about cecum. Cecum is the first part, and it begins from the ileocecal junction. Okay, ileocecal junction is the junction between the ileum and the cecum. Okay, and in this junction ileocecal valve are also present to prevent the food टू प्रिवेंट द फूड के वो ज़्यादा जल्दी से वहाँ से पास ना हो, तो उस चीज़ को वो प्रिवेंट करेगा. दैट इज़ to prevent passing food very quickly from that junction, from that opening. Now after cecum, between cecum and ileum, there is a diverticulum, finger like thin diverticulum, which is called as appendix, and the lumen of the appendix consists of crypts, which are called as crypts of Libercan. Okay, now appendix is not much very important. So moving further, after cecum, what happened, cecum is continuous with the whole large intestine is continuous, but there are some parts. So cecum is continuous with the ascending colon. Ascending colon is obviously it ends at the right colic flexure. Now what is right colic flexure? The cecum is continuous with the ascending colon. Ascending colon ends upward behind the you can say behind the right kidney. Okay, and behind the right kidney it bends. Due to this bending, a flexure will appear, and that flexure is called as right colic flexure, and it is present behind the right liver. So that's why it is also called as hepatic flexure. Okay, and one more thing which is very important, it lies at the level of L2 vertebrae. Okay, L2 vertebrae के level पे ये right colic flexure मौजूद होता है. Now after it bends, it forms a straight colon, a little bit slightly straight colon, and that is called as transverse colon. transverse colon is the part between the right colic flexure and the left colic flexure. Right colic flexure is also known as hepatic flexure. Left colic flexure is also known as splenic flexure because it is near the spleen. So what happened? From the left colic flexure, the large intestine will bend downwards, and after that bending, the part of the large intestine is called a descending colon, and the straight part is called as transverse colon. Okay, so between the ascending and the descending colon, the part is called as transverse colon. Okay, now moving more further, after the descending colon is continuous with the small straight like colon called as sigmoid colon. Okay, now transverse colon, the mesentery of the transverse colon is called as transverse mesocolon. Okay, remember this point as well. And the mesentery of the sigmoid colon is also called as sigmoid mesocolon. Sigmoid colon is also known as pelvic colon. Why? Because it is present near the pelvic region. होता क्या है कि जो इलियम है, इलियम द पार्ट ऑफ द स्मॉल इंटेस्टाइन, इलियम सीकम से कनेक्टेड होता है, सीकम ऊपर जाता है, असेंडिंग दोबारा ऊपर जाता है. ठीक है, आप डाइजेस्टिव सिस्टम का ट्रैक देखोगे तो आपको जो ब्रॉडर एरिया है वो साइड पर, इफ़ आई टॉक अबाउट द राइट साइड, तो राइट साइड पे वो अपवर्ड मूव करता है. ठीक है, जब अपवर्ड मूव करता है वो एक ब्रॉडर एरिया होता है जो कि सीकम से कनेक्ट होकर ऊपर जा रहा होता है, वो है असेंडिंग कोलॉन. फिर वो टर्न लेता है, बेंड करता है, ट्रांसवर्स कोलॉन, फिर वो वापस डाउनवर्ड जाता है, वो कहलाता है डिसेंडिंग कोलॉन. और जब डिसेंडिंग कोलॉन आता है, डिसेंडिंग कोलॉन के बाद फिर वो रेक्टम और एनल कैनाल के थ्रू एक्सक्रीट आउट होता है फूड. ठीक है, तो ये पूरा पाथवे होता है. ओके, नाउ वन मोर थिंग विच इज़ वेरी इंपॉर्टेंट दैट like I said, sigmoid colon. So sigmoid colon ends at rectum. Okay, obviously sigmoid colon is connected with the rectum at the level of S3, sacral vertebrae 3. So you have to remember the level as well. The right colic flexure is at the level of L2 vertebrae, and the left colic flexure is at the level of T12 vertebrae. Okay, and the connection of the sigmoid colon and the rectum is at the level of S3 vertebrae. Okay, so you have to understand this level and you have to write these important points. Okay, now after sigmoid colon, rectum and anal canal is present. Rectum is like I said, it is continuous with the sigmoid colon, and anal canal is after the rectum, and it is the last part of the large intestine. It is lined by stratified squamous epithelium. Now blood supply, if I talk about the blood supply, it's very simple. Obviously, as you know, the midgut and hindgut we will discuss in the embryology part. And so what happened, the large intestine is formed by midgut as well as hindgut. So that's why we can say that the blood supply of the large intestine is through superior as well as inferior mesenteric artery. So this was the whole topic regarding large intestine. Till then, work hard, study hard, and good luck. Okay, one more thing which I forgot to tell you, that the whole blood supply of the abdomen is in the separate lecture. So you have to understand, you have to watch that lecture to understand this topic clearly. If you will not understand that lecture, so what happened, obviously you will not understand the blood supply of the large intestine, small intestine. So मैंने क्या किया, उसको अलग रिकॉर्ड कर दिया ताकि आपको उसमें सब कुछ क्लियर हो जाए. So till then, work hard, study hard, and good luck. Take care. Bye bye. Thank you.